Good afternoon, everyone. A very warm welcome again to Kids Health Talk from MGM Children's, which is the Department of Paediatrics and Neonatology at MGM Healthcare, Chennai. We try to bring you these talks once a week, every Wednesday at around the same time, on topics that we think parents and families will find useful. The talks are given by pediatricians from MGM Children's and pediatric super specialists also from MGM Children's. We trust that you have found these talks useful so far. They will be available on Facebook to access at any point of time, whenever you need. So please feel free to go back and look at them if you feel the need to do so. If you feel that there are friends and family members who will benefit from these talks, please let them know about these talks too. I'm Dr Nisha M George, Senior Consultant Pediatrician, Pediatric ER at MGM Children's. Today, I'm going to speak to you about a topic I call Getting Children on Track for a Healthy Life. Ideas on Diet and Lifestyle. Start. What I really am going to talk about is something that is going to be a concern across the world to pediatricians and across India to pediatricians, which is the problem of overweight and obesity in children and adolescents. Next. Why is this a concern? So, studies have shown that over the last 40 years, there's been a 300% increase in the number of children who are overweight and obese. This is a remarkable increase in number and a cause of great concern. So, a recent study showed that at least a compilation of studies showed that there was a variation between 3 to 24% of children in the different populations studied across India who were found to be overweight, and 1.5 to 14% who were found to be obese. They found that after a certain age group, boys tended to be more overweight than girls, and they found that this overweight and obesity was a problem that started from very early childhood. Next. Why is this a problem? Why should we consider children being overweight or children being obese? Why should it be a concern? It is a concern because 50% of those children who are overweight and obese in their childhood become obese adults. And again, this is a concern because this overweight and obesity leads to a whole lot of what we call comorbidities or diseases because of that. So this results in diabetes mellitus, dyslipidemia, polycystic ovarian disease, liver disease in children and adolescents. And that is something that we need to take seriously. Next slide. And finally, at the end of all this, we would say, I'm sure as adults we know, losing weight that is once gained is very difficult. Thus, prevention is always better. And that is why this talk. Next. How do we understand, as pediatricians, what do we look at? How do we understand if a child is overweight or obese? Now, that is why regular visits to the pediatrician are important. Because at each visit, pediatricians all over the world and especially across India, we all have growth charts that tell us what is normal growth for this child, and where does a child stand against normal growth. So growth charts, we look at weight, height, and as this growth chart shows to you, we look at something called body mass index, BMI. BMI tells us it gives us a rough idea about the fat content or extra fat content for each child. Now BMI in adults, there are strict cutoffs. In children, we have what is called percentiles because BMI changes across age groups. So if a child is between the 85th to 95th percentile of BMI, that is 85% of children of that age group have a BMI less than that. So 85%, if their child is above the 85th to 95th percentile, then the child is overweight. If the child is above the 95th percentile, then the child is obese. So that is how we estimate whether a child is overweight or obese. And it is important to do this at each visit so that we know as soon as the child starts moving into the overweight side, so that changes can be made in lifestyle, evaluation to make that change different and prevent them from going further into overweight and obesity. Next. So when we see in a child in a clinic, if we see a child who we suspect is overweight or obese, first we look at etiology or the cause. We, for most, many, a few times we find that there are genetic causes, that there are certain diseases that predispose a child to be overweight or obese. But most often, it is a combination of multiple factors like environment and lifestyle that contributes to this overweight and obesity. So your pediatrician will ask to do a few tests, and at the end of it, will give you have an idea of what is causing this obesity or this overweight. The other tests we do or the other evaluations look at its effects. Now, overweight and obesity in children has multiple effects on organ systems in the body, like the liver, like fat levels, and it also has a lot of psychological effect on children. Unbeknown to many parents, many adolescents who are overweight and obese, especially, undergo a lot of stress at school because they are teased, they find a lot of discrimination, and a lot of times they don't speak about this. So it is really putting them under a whole lot of stress in school when they're overweight or obese. Little children to older children, they hear a lot of comments and a lot of criticism about their weight. And finally, as pediatricians, we look at how to treat this, and that is a multi-pronged approach. But here, my talk is not about how we approach and how we manage overweight and obesity. As I said earlier, like in many other diseases, prevention is much better than cure, much more effective. And here I would like to point out, often we have families who come to us, children who are overweight or obese, and often the families are telling us that, the child does this, the child does that, always watches TV and eats, doesn't go out to play. Unfortunately, I don't think, as pediatricians, we believe, I think the responsibility lies on us, parents, as us, as families, and definitely not on the child. The child, as I said, is already dealing with the problems of overweight and obesity, which did not start with their eating food, or their eating chocolates, or they're lying on the couch and watching TV while eating. It started long ago, systems that we as parents and we as families set in place. We as a society allowed them to be, which resulted in their obesity. So I suppose a first thing is to take responsibility for our children who are overweight and obese. It is not the child's responsibility. Until the age of 18, we are fully responsible for what category of weight that they have become. Next. Next. Prevention. So I'm going to talk to you about prevention. Next. Now, preventing overweight and obesity, there's a spectrum, and this is not proven, this is not hearsay, this is not belief, this is proven across science. Studies that show that across all ages, there is a lot we can do to prevent obese or overweight teenager. There's a lot we could have done much earlier. So let's start at the very beginning. Next. Next. Did you know that studies have shown that families with parents who are obese tend to have children who also tend to become obese? Not just genetics, lifestyle. So the first step before thinking of having children is probably to think of having fitter, healthier families, fitter, healthier parents. They do have found that women who put on a lot of extra weight in pregnancy also tend to have obese children. But so therefore, we need to take a look at families and families' health prior to having children. So fitter parents, parents who are seeking a fitter, healthier lifestyle. Next. Next. From birth until 1 year. So now the child is born. What can we do from the time the child is born, keeping in mind that your child has to grow up healthy? So what is the first thing? A lot of things in medicine, there's a lot of things in medicine that we do not know. But there have been so many studies that show the extreme benefits of breastfeeding. As we had in a talk earlier, it has been proven without doubt that exclusively breastfeeding a baby up to the age of 6 months and then continuing to breastfeed a baby even up to the age of 2 years, as per the WHO recommendation, is definitely contributing not just in immediate health of the baby, but prevents a lot of long-term diseases like obesity, metabolic disease, hypertension, diabetes, hypercholesterolemia as those children become adults. So please support the mother as she breastfeeds. I think mothers need a lot of support and encouragement to exclusively breastfeed their babies till 6 months of age and continue to breastfeed them up to 2 years. As pediatricians, we find that there's a lot of societal pressure that prevents mothers disappoint and downplays the importance of breastfeeding. In fact, it ends up in mothers getting very disappointed with how they are breastfeeding and unnecessarily so. So I suspect that if we support mothers in breastfeeding, it will go a long way in the health of our children. Next. Second, after children, so in this age group of 0 to 1 year, up to the age of 1 year, the second step, first is breastfeeding. The second step is complementary feeding. It's not weaning food. You're not weaning off breastfeeding. You're continuing to breastfeed the baby. But you are also introducing other food to add to the nutrition of the baby from the age of 6 months onwards. Now, it has been shown in studies. So, what you do is gradual introduction of complementary foods. Start slowly at 6 months of age, as your pediatrician will advise you, and then gradually introduce a variety of food so that by the age of 1 year, traditionally, they're eating from the family pot. So, what the family eats, they're eating. In addition to that, of a variety of cereals, fruits, and vegetables at an early age is very important. Please follow your pediatrician's advice. Go slowly, but by the age of 1 year, the child should be eating a variety of small meals of different food groups to keep it healthy. Next. In health, I'm going back to the point number 2 about complementary feeding. Children up to the age of 6 months are breastfed. After that, we introduce other foods to increase the nutrition of the baby. This goes side by side along with breastfeeding. So it's called complementary feeding. There have been studies to show that if you introduce a wide variety of complementary foods before the age of 1 year, your child tends to be far less fussy when they cross the age of 1 year. And they are open to eating a variety of fruits and vegetables beyond 1 year. So the idea of complementary food is to introduce food gradually, and your pediatrician will give you good advice regarding the same. And gradually, by the age of 1 year, to be eating from the family pot. So eating what the family eats, in addition to having breastfeeds. So introduce a lot of cereals, fruits and vegetables. A variety of fruits and vegetables being offered to the child before the age of 1 year makes them much healthier eaters after that. Next. Later. Same. If and apart from these, there are a lot of healthy healthy feeding behavior. Now, as you all know, as you are all aware, and if you look around you, you will see that children are far more exposed to television, videos, mobile phones, because there's a lot of what is called child-friendly content on all of these nursery rhymes. We think that we're educating children while we're doing this, and but studies have shown that actually the American Academy of Pediatrics says under the age of 2 years, children should not be exposed to any screen time. However, I understand that families definitely find it much easier to feed a child when the child is distracted. So keeping a TV or a mobile or a video going while the child is eating is often followed, and it is understandable, but is not necessarily advisable. Why? Because next, one of the healthy practices is not to keep this. So the child is focused on the food and not distracted. In fact, it is good to have children interact in their feeding. So when the child is able to sit, rather than making them lie down and force feed them food, which is not at all advisable, it's good when the child is able to, from the age of the child can sit, be able to sit, from the age when they can eat finger foods, which they can just chew on. Even if they make a bit of a mess, it is good to have a child interact when they're eating. This is a healthy food habit that will help them to have healthy food habits later also. Next. So eating with participation. And another point, one of the fifth points is specific, I suppose, to our country, is a concept that many families and especially mothers come under great pressure because the society gives them a lot of comments about children who society doesn't feel are healthy because they are not chubby, not plump enough. Now, I suppose an increased awareness should come, and we are often found counseling families saying, no, the child is appropriate for weight, the child is not small, the child is absolutely fine, and we show them the growth charts to see that the child is okay. Now, they found another example of this is when they initially started creating growth charts. The American Academy of Pediatrics plotted children on growth charts to find what is normal. They found that they had plotted these charts on formula-fed babies, and then recently the WHO, many years ago, put together a set of growth charts, countries across the world, using breastfed babies because that is normal. And they found that the centiles are remarkably different. You don't have to have what is acceptable and normal in older children, the weight gain of of children. It is far better for them. The breastfed babies have a healthier growth trend. So maybe we should encourage society not to look at it as chubby as healthy. Next. Next, we go to the next age group, young children. What is specific to young children and feeding? One, a continuation of what I said is complementary feeding, a variety of healthy foods in the diet. So a concept of something initially was what the food pyramid. Now it's called a food plate, as you can see in the picture. Trying to introduce at least 50% of fruits and vegetables on each plate that the child eats. 50% of fruits and vegetables. A variety of healthy foods in the diet. And a second component. So what causes obesity and overweight is an increased caloric intake and a decrease in outdoor play, in activity, physical activity. So increasing outdoor play for 60 to 90 minutes every day. Take children out. We speak from Chennai. Chennai has a lot of community parks, a lot of places where children can go and play. So take children out, let them play. 60 to 90 minutes of outdoor play is recommended for all children. Number 3, restricted television watching, and definitely no television while eating. So part of healthy food habits is no television while eating. Children who, along with their families, I must say, snack while watching television, eat while watching television, tend to have much higher risk of being overweight or obese. So therefore, restricted television watching overall, and definitely no television watching while eating. Next, having family meals. They found that children who have meals prepared at home and having family meals together contributes a lot to overall health. What we have found is, and the entire family being physically active also contributes to the child's overall health. We have found that children and families it is unfair to the child to tell the child, you need to do this, while 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 the rest of the family doesn't do anything. So it is important to do this as a family activity where uh, they are participating in family meals and also participating in physical activity as a family. Next. So take children out. There are a lot of activities that children can do. Living in Chennai, there's so much unstructured and structured play. Structured play. If children can be put in to different games that they enjoy, and the structured play, learn a game, learn shuttle, learn swimming, that is structured, or unstructured play in park. 60 to 90 minutes of outdoor moderate exercise is important. Next, please. Then we go into the other group of older children and adolescents. So what happens? The same factors continue, but increasingly we need to identify the need for physical activity. So encourage children to, if schools are of a appropriate distance, walk to school, walk to other areas where they need, cycle with all, of course, safety devices. Next. Play a game. This would be a time where children are more open. They've found their areas that they like. So play a game, something that they like. Don't force them into something that they don't like. Martial arts, structured games, shuttle, cycling, swimming. There's so much that they can do in the city. 60 to 90 minutes of outdoor play. Next. Involve all family members in healthy diet choices. So it is not, the burden does not just fall on the child to be healthy. While you're not just instructing the child, children and adolescents, especially adolescents, don't like to be instructed. It would much far better help them if they are part of overall healthy behavior. Next. And increasing their understanding of good food choices, restricting the intake of snacks and flavored sweetened drinks really helps them. If you talk to them and talk to them about how there is a lot of pressure and there's a lot of availability of a lot of unhealthy food, but this not necessarily contributes to their well-being. This goes a long way in making them part of the choice of a healthy lifestyle. Next. So in our country especially, you find that a lot of children, and a couple of papers have mentioned this, that a lot of children, especially in the 10th to 12th, because there is this immense pressure to study and get marks, that they find that parents say, no physical activity at all. All you're doing 24/7 is it as an extremely sedentary lifestyle, where they stop even the physical activity they were doing earlier. They're learning dancing or they're learning martial arts, and they just sit and study the whole day, except for the time that they sleep. So they have sedentary relaxation, watching television, listening to music. So there's a lot of physical activity that decreases during those years. We should make it a point to make sure our children go out and play even during those times. Finding the time is difficult. You'll find fresher children who do much better academically if they do other things like this and physical activity. Next. So with that, I conclude. Thank you. Um, these are just pointers to encourage you families to take children from before the children are born to the time that they are adolescents, what all we can do to encourage a healthy lifestyle, prevent them from going into overweight and obesity, because once they are in overweight and obese categories, it is very difficult, as we as adults know, very difficult to step back into into situations where we can lose weight and we can get back what we have lost. So it is much better to prevent. But in case you feel the child has a problem of overweight and obesity, always contact your pediatrician. There is a lot that we can do to help. There's a lot that we can do to treat children with overweight and obesity. Thank you. Okay, there seems to be a question. What is the right time to give fruits to children, morning or evening? That is a question. Thank you. A lot of children, a lot of families do have. But science tells us that fruits and time of day really don't have any connect to each other. It is not fruits that cause. There's a lot of negative feedback about fruit. Many families are afraid to feed children fruit. Sometimes the child likes it, but the family is not giving them fruit because they're afraid that fruits cause them cold and cough. But science does not show that. Science shows us that cold and cough are caused by viruses. And as the pandemic showed us, the minute that we had lockdown, the number of children who have cold and coughs, you would have noticed in your own household, have dramatically decreased. Why? It's because children are exposed to viruses, and in their school, in the environment they play, they transmit viruses from one child to the other. So that is what causes cold and cough, not fruits and vegetables. So there is a common health belief, cultural definitely, that tells us about cold food and hot food. Um, as pediatricians, there doesn't seem to be the evidence to suggest that there is this fruit and vegetables are definitely healthy for children, and 50% fruit and vegetables contributes greatly to health in children. So we had a child recently who came to us, an adolescent who who was obese. Um, Unfortunately, what happened was, yes, it was because of another family member who brought her. Now, if an entire family is in the overweight and obese category, I suppose it's difficult to understand if your child is overweight and obese. And adolescents don't talk much. So it is important to be in touch with your adolescent to understand if this child was, we found that she's a classic example of what goes into a child who's overweight and obese. Not only was she having borderline complications of obesity, which one of the signs you'll find is that there'll be a darkening of skin around the neck, under the armpits. This is called acanthosis nigricans. That tells you that there is a certain amount of insulin resistance and a potential for diabetes. So then the other complications of lipid alteration in lipid profile, which all need attention. In addition, a very important factor that happens to children and adolescents who are obese, and not just in our country, is that they face a lot of discrimination and a lot of ragging, sometimes that they don't tell us about. So it is important to be in touch with children, strengthen them for how to deal with this, and seek out your pediatrician to find ways to treat it. If there are any further questions, I think there are none. Thank you very much for your attention. Um, Goodbye. Um, we will be having our next talk on ophthalmological conditions that affect children. So please, we will let you know when it is.